Are you wondering if there's a best time for you to get a hair transplant? Generally speaking, I think the best time for a patient to get a hair transplant is in their 30s. When you're in your 20s and you're starting to have receding hair, it's better to start using medications or non-surgical treatments in order to treat the hair loss. There's some shampoos you can use, there's Rogaine Minoxidil, there's even Propecia. The reason you may not want a hair transplant then is you are probably going to continue balding or having receding hair over the next decade or two. So if you were to do an early transplant, you may continue to bald past that, and it's gonna look very awkward. Once you're in your 30s, however, most balding begins to slow down. At this point, as long as you're taking medications, you can usually maintain your hair, and then you would use a hair transplant to restore the hair that you lost or just to increase your overall density. If you wait too long until you're older, you may not have started any of the preventative medications, and you might have lost a significant amount of hair. You can only transplant a limited amount of hair over your lifetime. This generally ranges between 3,000 to 5,000 hairs depending on the density of your donor site. If you have any questions or you think you might be ready for a transplant, feel free to DM me or give us a call.